Welcome, everyone, to today's episode of Carefulist, the podcast. I'm Katie Christophic, founder of the Carefulist. Today, we welcome Kim Feth, who is the founder of Healthcare Survival Kit. Welcome to the show, Kim.
Thank you for the invitation. I am just honored to be here today.
I am really happy you're here because you're doing some super cool things.
Thank
We'll
you.
get to that in a bit. Let's start at the very beginning. Could you please share your caregiving story with us?
Absolutely. The current caregiver story is surrounding my husband. He walked into the hospital on June 7th, 2024, and was supposed to have a spinal fusion surgery, standard surgery, big surgery, but standard. Go
Mhm.
home 5 days later, have a 6-week recovery, go back to work. And it didn't happen. He spent 30 days at that hospital. He and then two other hospitals later, including a subacute rehab. He came home on September 26th of
Oh,
2024. So from June to September was spent in a hospital or some sort of a level of rehab hospital. And he is actually still relearning how to walk. Because if there's a gap in the healthcare system, we found it.
yeah.
We got pushed into it, we fell into it, we stumbled into it, and every time we kind of claw our way back up. Um, but it's prolonged all of this, unfortunately. What should have been a much more rapid recovery had things been better managed,
Mhm.
you know, he would already be up and walking. Um,
Yeah.
so that's got us here. He is home. He has made such amazing progress starting the day he came home, and then another 3 months to find the right outpatient therapy for him,
Mhm.
and traveling at 3 hours round trip for each of those therapy appointments, and everything involved with getting in there, including renting a handicapped accessible van, running out of visits, plugging in free physical therapy through a DPT clinic,
Mhm.
and on and on and on. And actually, now he's getting services at home. It's a level of service called community access therapy. And he
Mhm.
has a neuro physical therapist and a neuro occupational therapist coming out to the house, I guess about 10 hours a week combined.
Wow.
And he's making amazing progress.
Isn't it crazy, unbelievable that it is so hard to find the right thing? But then when you do progress, it's astounding.
It boggles the mind at the right therapy. I had a boss, he used to call it trying to score a touchdown with a baseball bat. You can't do that, right? Like that's not
Right.
a thing, right?
Yeah.
And I have carried that with me all this time because like he spent 60 days in a subacute rehab, but at that point no one had said, he's less like an orthopedic patient. He's a lot more like a spinal cord patient. You need neuro. No one said that until October.
Yeah.
And that was when we started, down a different path. But so we spent 60 days of subacute inpatient rehab because while I am a social worker by training, medical social worker, I was too busy being the scared, exhausted, nervous wife, right? You
Yeah.
can't be the advocate and the nervous wife. It's just too much.
Right.
And no one was like, he needs neuro PT. So we spent 60 days getting orthopedic physical therapy. So it was literally, it was trying to score a touchdown with a baseball bat. It just,
Yeah.
you can't do it.
Oh
He
my
made
gosh.
small incremental strength changes, but
Mhm.
no meaningful rehab progress in those 60 days. So
Oh, I am so sorry.
thank you. Thank you. But you know what? We decided at some point, I don't even know what, everything's going to be hard
Mhm.
and you have to pick your hard, right?
Yeah.
Staying in a wheelchair and not making progress is going to be hard. Working with a physical therapist for 2 hours and then turning back around and going to lead a meeting at his work is also hard.
Hmm.
but which outcome do you want? You have to pick your heart. And some days, as much as we've said that to other people, some days he looks at me and some days I look at him and the words are still the same. Sweetheart, I love you. I just need you to pick your heart today. Which heart are you going to reach for today? And we just
Hmm.
keep walking forward. Like, this is life, right? Like,
Yeah,
this is where we are. So we're just going to keep moving forward from here.
right. You mentioned an acronym in your intro that I thought we could explain to folks and talk about
Okay.
a little bit. You said DPT.
Oh, I'm
Um,
so sorry. Thank you.
no,
Yes.
to apologize, but I think
Most,
it's really good for people to know what it is.
it absolutely, excuse me.
That's okay.
I am in North Carolina. I am drinking my unsweet tea from a mason jar. So, in order to practice physical therapy, at least in the state of North Carolina, and I think mostly nationwide, you have to have a degree called a doctorate of physical therapy. That's a lot of education.
Hmm.
And the good thing for all of us is that if you are close to a university and they have a DPT program, those students need experience in putting their hands on patients while
Hmm.
they're supervised by their professors, most of whom have even more advanced degrees.
Hmm.
And it's just kind of amazing to see. So, as we were getting to the end of all of our insurance covered visits, and it was obvious he needed more, we started going out to the free, it's called a student led DPT clinic. So, it's
Hmm.
led by the students who are in the Doctorate of Physical Therapy program. We were fortunate enough to get one out at ECU Health, which is in little old Greenville, North Carolina. Believe it or not, I used to work at the hospital there as an inpatient social worker before these DPT students were even born. But we got to go there. And so we got a third year student, a second year student, and a first year student, and then typically one, if not two, of the professors. Not
Hmm.
everybody gets that level, but my husband's a big, tall guy, and he is literally a rehab unicorn. The professor told them on day one, you may never see this again, so I need you to see it now.
Wow.
And that just like I just got chills up my arms again.
Yeah.
And so it was fortunate for us because we got some really valuable physical therapy. And
Hmm.
it was really valuable for them because, he wasn't a lot of who they serve are people like my husband, where we run out of PT visits, or they
Yeah.
don't have insurance, or their insurance doesn't cover PT, so they can access it that way. But a lot of that is like, I sprained my ankle, I have tennis elbow, I rinsed my back. And those are all legitimate reasons to go get quality physical therapy. But seeing a guy who should have recovered from surgery, who spent, weeks in bed because he couldn't feel his arms or feel his legs, and like it was just such a unicorn in that rehab setting that
Yeah.
they were able to do a lot of learning, and they loved it because with my social work background and my husband's operations background, we're able to give like the sequential history, so we were
Hmm.
able to move them through how everything occurred. But they also then got to learn about the gaps in the system and the strengths, where the strengths are. And then
Hmm.
one of the stories we love to tell. So my husband has a Hoyer lift at home, and if you're not familiar with it, it's you have a little a lift pad. It's called a lift pad under the patient, and you strap them up and you push a button, and it raises them up off the bed, and then you can transfer them into the wheelchair. It's called a Hoyer lift,
Hmm.
and we'd been taking it, but we'd been leaving it out in the hallway mostly. But one day we brought it in with us, and the professor, I mean, it was just packed full of students whose patients, some patients show up, some don't. But she said, students, if you're not with a patient, turn and look at me. And they all turned, all but one turned and looked at her, and she said, if you've never used a Hoyer lift, raise your hand. Well, they all raised their hands because none of them had ever used a Hoyer lift. She said, okay, come on, it's time to learn. So they all gathered around, and she showed them how to hook up the straps and unhook the straps, and how to lift and how to guide and how to lower. And then everybody got a chance to raise and lower Jerry. So he spent like 30 minutes up, down, up, down. And we were, I was in the corner rolling laughing. But literally, like, this is the kind of education our future physical therapists need, right?
Yes.
Jerry and I, at one point, we were laughing together because in a hospital setting, you're always going to have someone else in the room
Mhm.
when you, as a professional, are using the Hoyer lift. So the professor, very smart of her, says, students, never use the Hoyer lift when you're alone. And I busted out laughing. I said, unless you're home and Law and Order's on and it's time to transfer back in bed so you can eat dinner late. I was like, and then you can just do it by yourself and with one hand. It's going to be okay. They were like, what? So, we got to learn from each other and we all got to laugh at things like that. But it was some amazing service. So if someone needs to access free physical therapy, they literally need to think, where am I geographically located?
Mhm.
What universities are near me? And then literally the Google search is free student led DPT clinics near me. And Google will spit it all out.
Excellent.
Now, when you're exhausted and you're overwhelmed and you're a caregiver, you don't always think that through. So, for
Mhm.
instance, if you're in North Carolina, I've actually got a freebie on my website where you can go and download the list. And it's not just the list, it's the phone number, the website, the email, the street address, all of that. So, I've tried to make that easy for the people
Mhm.
coming behind me.
Yeah. Oh, well, thank you for sharing that story because
Yeah.
until I had spoken with you, I did not realize those free clinics existed. And I'm
Yeah.
sure most people don't know. So thank you for sharing
Most
that.
people don't. Yeah. You're welcome. Thank you.
Yeah. And it's funny. I think this is also the first time somebody's talked about and explained a Hoyer lift, believe it or not.
Yeah, so they're not common in a home care setting,
Mhm.
mostly because number one, they're expensive. And
Mhm.
number two, a lot of people that have a Hoyer lift system are typically not using their lower extremities, mostly probably for the rest of their life, whether
Yeah.
it's from a neurological disease that's progressive or from a spinal cord injury,
Mhm.
at which point then they will typically get a ceiling track system
Yeah.
installed in their house. But because his is temporary, although temporary is now apparently relative, but so we got the Hoyer lift. But the funny story behind the Hoyer lift is that, how do I say this? The discharge planning is broken, and I used to be a discharge planner, but the
Mhm.
discharge planning they do now, it's not what I was doing back then. So
Yeah.
I felt the need to drive that process from the
Mhm.
final hospital discharge, which was what's called a subacute level of rehab. So I called the insurance and found out who I needed to call after the insurance to find out who the providers were, because the insurance doesn't tell you who the providers are, they tell you what's covered.
Mhm.
So you have to make multiple phone calls because you have time to make multiple phone calls when you're a caregiver and discharge is looming.
Oh,
Okay.
yeah. I mean, you're
Yeah, yeah,
just
of
sitting there
course you do.
waiting for something to do.
Absolutely. So insurance, 45-minute phone call. Provider, another 45-minute phone call,
Mhm.
mostly on hold, right? Get the name of the network providers. And it doesn't sound right because I'm I'm just like 30 minutes outside of the state capitol. And I'm familiar with a lot of the players, and she was naming companies that I was like, this just doesn't make sense.
Mhm.
So I told her to have a nice day, and I'm sure she'd been as helpful as she's empowered to be. And I hung up, and then I waited an hour, and then I called back and got someone else, and they gave me a list that did sound accurate. So never take the first list at face value. So they were able to tell me who, and then once I knew who, then I had to call back to the insurance, another 45 minutes on hold to find out what equipment is covered. So literally 4 45-minute phone calls later.
Yeah.
Well, here's what I always tell everyone, and I've even got a tool to give people, and it's an insurance log where you record all the details from your call.
Mm.
But as an overwhelmed, stressed out, sleep deprived wife, I didn't have all the details I needed,
Yeah.
but I did have the date. And I wrote down in my handwriting what was covered, and I wrote Hoyer lift, and I had a check by it. Because I had a list of all the equipment he needed. And as we went through it, yep, check, yes, it's covered. And it had a check mark by it. I knew she said it's covered. Well, then the bills start to roll in, as they will have want to do during a medical
Mhm.
crisis. And everything was getting paid except the Hoyer. I thought, this is weird. Like hospital
Yeah.
bed paid for, bedside commode paid for, all that other stuff paid for. Not the Hoyer lift. Like, how else am I supposed to get my 6'3" husband in and out of the bed?
Hmm.
So I start making phone calls to the insurance company, at which point they literally said, we're not concerned with how you get him in and out of bed. This is not a covered piece of equipment.
He could get hurt. You could get hurt. I mean,
Or he could just
that
spend the
makes,
rest of his life in bed and die, right? But remember, health insurance is about a contract,
yes.
not about what's right or wrong. It's about what's in the contract. So 6 months worth of phone calls. I called once every 3 weeks. It was on my calendar. And at this point, I've calmed down enough to have my written notes.
Hmm.
And after month 6, I was so frustrated. I I pulled the power move and I said, I want the entire denial record. I want internal memos, internal emails, internal Slack or chat messages. I want the pages from the detailed plan that expressly state that this is not a covered service. And
Yeah.
I want the credentials for whoever is making this decision. I know that you have that right under the Affordable Care Act. And I informed him of that. And he said, no, you don't. Mm, yes, yep, I do. I have that right. And I need you to understand that if you don't get that to me within 30 days, you're violating the Affordable Care Act. And I said, so I'm going to need your full name and I'm going to need the call reference number from this because when you violate my federal rights, I'm going to want to reference your full name. He got really quiet. And I just let that awkward silence sit there.
Yeah.
Well, I'm not going to rescue this guy. And he said, I think you should talk to a supervisor. I said, that's how I started the conversation. That would be great. Talk to the supervisor. And she said, yes, ma'am. We'll get on that for you. Literally 2 hours shy of 30 days because I was on the phone with them. I hung up the phone with them at 5. They had until 5 p.m. that day, day 30, to send me that information. At 3:01 p.m., the phone rang and it was a representative from the insurance company and she was talking really fast, probably because she wanted to get me off the phone. And
Hmm.
she said, you were right. Because you provided the day and the time of the phone call, I was able to go back, pull the recording, and we did in fact state to you that a Hoyer is a covered product.
Hmm. Fancy that.
So at this point, it has now taken me almost 9 months to get to
Yeah.
this point. The DME provider has not been paid for this product yet. And she said, but as of today, we will stop paying. And they paid the DME supplier $2,000, almost effective immediately. And I made sure she knew that I knew that they had threatened to violate my rights under the Affordable Care Act. And she said, yes, and I need to go now. Like she couldn't get me off the phone fast enough.
Hmm.
So I'd been in frequent contact with the DME supplier, which is my best advice to anybody. If you're duking it out over a medical bill, stay in contact with that provider. Let them know you're working towards resolution with the insurance company.
Can you share with folks what DME
I am
stands
so
for?
sorry.
That's
See,
okay.
I need people like you in my life. DME is durable medical equipment.
Hmm.
And so it's the things you can't go pick up on the shelf at your local drugstore or bricks and mortar store. So
Yep.
it's the hospital bed, the bedside commode, the slide board transfer, the Hoyer lift, the things like that. They're actual
Wheelchairs
pieces of
and
equipment, wheelchairs, all of that, right?
okay. Hmm.
And thank you. Thank you so much
Sure.
for catching that acronym for me. Thank you. And so I had been in touch with that local supplier. So number one, I when they gave me the list of who that I told you they gave me the list, I went
Hmm.
with a local supplier because
Smart.
doing good business with your neighbors is always a good business model. And I wanted a local company.
Yeah.
I went with them. They've worked with me every step of the way. And as soon as I hung up from the insurance company, I called them back and she said, let me pull it up. And she said, Kim, literally, I'm watching the money flow in. Literally, I'm on the phone watching the money flow in for this payment. And so I said, okay, so they're not going to pay going forward. Here's how much she told me they're paying you. She's like, that looks right. I said, what do we need to do to own this Hoyer lift outright? And
Mhm,
she said, how about you pay us? And she gave me a totally reasonable amount.
mhm.
I paid it that day, and we now own a Hoyer lift, which is the only way I've been able to get my husband from the bed to the wheelchair
Yeah,
and facilitate his recovery.
right.
And I don't know what we would do without that Hoyer lift, which we just laugh at because when the physical therapists show up, they're like, oh, you've got your own Hoyer lift at home. It's pneumatic. I don't have to crank it. I just push a button and they get so excited over that.
Yeah.
But that is literally what has helped him recover. And you
Hmm.
know, we were really struggling with why is this an issue
Yeah.
with the insurance company? And I went back to my notes. And one of the conversations towards the end was, well, it doesn't say it's covered, but it doesn't say it's not covered. And I said, well, in my world, that means it's covered. So
Yeah. If it doesn't
that's
say
how
it's
I
not,
interpret that. I'm sorry you wrote a vague policy, but I'm very clear on it.
right.
And so we got it, but like we later on we were working on my husband's wheelchair issues, a whole nother story, funny but not funny. And the gentleman from the company that makes his custom electric wheelchair
Hmm.
made the most horrific statement that made me so angry. And then I suddenly realized he's right. And it explained all the struggles.
Mm.
His words were, your health insurance company doesn't care if you walk because to them, walking isn't medically necessary.
Oh,
And like my heart stopped. I thought I might like get sick to my stomach. I was instantly in a
yeah.
rage. And then as quickly as I flew into that emotion, I thought, you know, he's right. Like all the battle with them has been about getting him up and walking. Now,
Yeah.
kudos to the insurance company. My husband has a custom electric wheelchair. And people think, what is that? It's a $23,000 computer with a cushion, some wheels, and a joystick. Like that is literally it's a $23,000 product.
Yeah.
They paid for it the first time we asked. I had my boxing gloves on. I was ready for the fight. I was like, I'm gonna have to appeal this. No, nope, approved it, paid within 7 days. But you're gonna make me fight over a $2,000 Hoyer.
Yeah.
It makes no sense.
No.
But that's why I just have to be my husband's advocate.
Right. And it goes back to what you were saying before about choosing your heart,
Yeah,
right?
yeah.
So it's hard to be wheelchair bound.
It
And
is
if
really
you
hard.
have the opportunity to walk and you want to do that, it makes no sense that the insurance company would stand in your way.
It makes no sense. I understand them wanting more information because he is such a unicorn. Let me just explain. If you
Mm,
have a knee replacement, all right, you go into the hospital, you have your knee replacement, right? Day one, you do A and B. On day two, you do A, B, and C, right? And it doesn't matter if you're in Wilmington, North Carolina, or you've crossed I-40 and you're in Barstow, California. You are literally going to walk the identical recovery path because they've got so much data to
mhm.
inform how to have the best recovery, right? That's
Yeah.
awesome. But when you get a unicorn like my husband, no one really knows what to do.
Yeah.
So then they just all stop doing anything.
Right.
And you know, in talking with him, we what we've realized is at that first hospital where he had surgery, it was kind of like living in Groundhog Day. Every day, someone
Mm.
from the surgical team would come in and say, "Did you walk yesterday?" And my husband would look at them and let me just back up. When he woke up from surgery, he couldn't feel his arms or his legs.
Oh, that's so
And he
scary.
couldn't feel the arms because he was like on his stomach, Superman style, for 9.5 hours with the arms tied down. to a table so they could do the surgery, which
Hmm.
pinched off all of these nerves up here.
Hmm.
It took about 3 weeks for him to get sensation and movement back in his arms.
Wow.
A little longer for the fingers, still has some sensation that may never come back.
Mm.
And sensation didn't start to come back in the legs until like, I don't know, October, November, really.
Wow.
But no one, so I'm sorry, let me, I'm talking in circles because
No,
I
that's
just love
okay.
sharing this story and it helps other people.
Yes.
But every day, someone from the surgical team would walk in and say, "Did you walk yesterday?" And we'd say, "He still can't feel anything. So he's not really able to, push himself up and stand up." He'd say,
Yeah.
"Okay, well, try again today." And we were like, "What's going on?" And the PT and the OT would come in and they'd be like, "All right, let's get up." And he would be like, "Okay, I'm going to need you to lift my hands and place them where they need to go because I can't use my hands. And I'm going to
Hmm.
need you to move my feet because I can't feel them and move them."
Hmm.
But what should have happened when he strayed from that standard surgical path,
Hmm.
someone should have pulled back to that 30,000-foot view to
Yeah.
say, nothing went wrong in the surgery, but there are these odd one-offs, these one in a millions. And when you sign your surgical consent, it's at the bottom, right? The
Hmm.
following, complications may occur, and someone's family member has to be in that 0.1%, right? And it turns out it's my family member.
Right.
So, but these things happen, but no one pulled back to say, what we think should be working isn't working.
Hmm.
Let's try something else. Like
Yes.
if orthopedic PT and OT isn't working, and it's great. I mean, we've got qualified providers, but let's try this thing called neuro PT and OT. And let's see if we can't wake up some of the nervous system. The day he started getting neuro PT and then neuro OT out at ECU Health in Greenville, North Carolina, nerves started coming back online. He woke up the next morning and he has this cute little whisper when something new is happening, and he'll say, "Kim." And I'll say, "What?" He'll say, "My left fourth toe is tingling." And I'll say, "Does it hurt? Do you need some medicine for that?" He'll say, "It hurts, but I'm just going to enjoy it. I don't want any medicine for it. I just want to enjoy feeling the tingling sensation." So,
Yeah.
literally, the day he started getting the right therapy,
Hmm.
he started making meaningful rehab progress.
Yeah. And
And
that
he's still making it.
illustrates one of the huge gaps in the system, which is the lack of problem solving. If it
It
doesn't fit the cookie cutters, prescribed, whatever, people shut down. We had the same experience with my mom and her dementia when
yeah.
she fell and broke her wrist and she had to be in the hospital overnight. What's your name? She can't tell you. She has Alzheimer's. We need you to say your name. She can't tell you. She has Alzheimer's. Well, can she tell us her birth date? If she can't tell you her name, she
Yeah.
can't tell you her birthday either.
Yeah. The lack of bedside problem solving,
It's astounding.
it is a little concerning. And I'm
Yeah.
not 100%, I can't pinpoint one specific way in which it has declined.
Yeah.
But I think there were some misses with clinical training during COVID. We
Hmm.
certainly experienced that. Um, I mean, and COVID was COVID, right? We can't go back
Yep.
and undo it, but you don't learn in a lecture what you learn by being in a patient room
Right.
with an experienced mentor nurse. You just don't, right?
Hmm.
And then I think they are so pinched to turn over beds.
Yes.
And I think the staff to patient ratio has become so skewed. They
Hmm.
literally don't have time to engage in problem solving.
Right.
And my heart goes out to them because when you talk to them, and our personal philosophy has always been be that nurse's best friend.
Oh, yes. That's the
Ask
smart
about
thing to
them.
do.
Yeah. Yeah. I mean, no one ever asks about them. So if you do, you're a delightful patient.
Hmm.
And they got to where they were looking forward to coming and I'll be back in 3 days. I'm gonna see if I can be your nurse. And we're like, that's awesome. You
Yeah.
know, but the push is to get them out the door so they
Hmm.
don't break those code days, because the number of days you can stay is based on your initial diagnosis.
Yep.
So my husband should have stayed for a maximum of 5 days. He blew through that. Like,
Right.
he was there almost 30 days. He was there 29 days.
Oh my
So,
gosh.
that hospital lost money on him.
Hmm.
Not my problem. These
No.
things happen, but and I think that's kind of where discharge planning has gone wrong. When I did discharge planning, I was in your room the day you were admitted,
Hmm.
and we started talking about discharge, and we talked about barriers and strengths and goals and everything else you needed help with, I addressed. And
Yeah.
here it's okay, you're going home
Hmm.
or you're going here.
Right.
And we experienced that with my husband at that level one trauma center where he had the surgery. The social work discharge planner walked in the room. We connected. I said, I used to do it. She's like, that's great. So, you know my job. She did not introduce herself to my husband. She did not ask about his goals, his dreams, his fears, nothing. She looked at me and she said, I think you should just put him in a nursing home.
What?
Katie, I can't even fly shade. Really loud, really naughty words came streaming out of my mouth. Like, I was later on, I was so horrified. I tried to find her so I could apologize. Like, that's not who we are.
Well,
But that was so, I mean, I know we've got some gray hair, but we're in our 50s. He works for an international nonprofit. He runs a massive computer network.
yeah.
I don't think that's right. And the good thing was, I had a friend who's an occupational therapist kind of whispering in my ear with texts and phone calls saying, don't you let them put him in a nursing home. If he goes there, he will never walk and he'll never come home.
Yeah.
So I had to fight that battle. I fought it at the first hospital. At the second hospital, which is called, the acronym is LTAC, it stands for Long Term Acute Care Hospital. So
Hmm.
it's for people who need a slower on ramp to rehab, which he did.
Yeah.
And so we went there, and amazing facility. So, I mean, there are only 5 of them in the state of North Carolina, and they're all really small. Like, I think this one has like 42 or 44 beds. So very small. We were fortunate to get one close
Hmm.
to our home with a bed, amazing care. And again, the crack in the healthcare system was the discharge planner.
Yeah.
Because as you know, if you've taken care of your mom with dementia, life doesn't stop because you're a caregiver, right? It
Yeah.
just keeps rolling into everything.
Yes.
So while he's in this facility, our house takes a direct hit of lightning. And the electrician walked around the house going, how did your house not burn? And how are you should have died in a house fire last night. And I'm like, okay, I didn't. So tell me if I need to go buy a lottery ticket. And he said,
Well, that's
no,
what I
ma'am,
was just thinking. So your husband's a unicorn, your house gets struck by lightning.
I like, really? I like, okay. Like, I had a spiritual like struggle there. I can't, it just
Yeah.
was hard.
Yeah.
And it wasn't the heart I picked, but it was the heart I got handed. But,
Yeah.
I lost track of days because I was busy handling home repairs and, homeowners insurance, all that stuff.
Right.
And I called on a Tuesday. I thought, wow, I haven't heard from them. I left her a message. She called back 3:45 p.m. on a Tuesday. She called back and said, great news. Your husband's coming home on Thursday. And I sat there for a second and I said, well, that's going to be a problem. She said, oh, why? And I said, well, we don't have a hospital bed, a wheelchair, any equipment, no aid services set up. I haven't been trained. He can't independently log roll. He can't sit up. He can't transfer. He can't stand. And by the way, because I didn't know this was coming, it's my turn to take our special needs sister to an out of state family event. So I won't be there. I'll tell you what we're going to do. You discharge him on Thursday. I'm going to leave you a house key under the doormat. You follow him home and you take care of him all weekend. And when I get home on Sunday, you can tell me how that went. And then I just stopped talking.
Yeah.
And she said, I'll call you back. I said, why don't you start by reading the chart?
It
Because
sounds
it's
like a good
apparent that you
plan.
haven't done that, and then call me back.
Yeah.
She said, okay. I said, but now understand this. Do not, above all else, do not print a list of nursing homes in our area
Yeah.
that take our insurance because my husband is not going to a nursing home bed.
Right.
She said, yes, ma'am. She printed a
Of
list of nursing homes, highlighted the
course
ones
she
that
did.
take our insurance, and dropped it off in here in his room and said, you need to talk with your wife. No, I need you to do the job for which you are paid. It's not that hard. And she said, well, what did you want? I said, I want you to call Shepherd Center in Atlanta and find out if he meets their criteria.
Mm.
To which she responded, what is Shepherd Center? And I was kind of that. Then I realized the quality of the training of the person I was dealing with. Now, do you know Shepherd Center in Atlanta?
I do not.
Okay. If you were on the East Coast, it might be Southeast now, but definitely East Coast,
Hmm.
and you have a family member with a spinal cord injury, there are lots of great places to go. Shepherd Center is kind of the king of that mountain. They
Okay.
have the most amazing spinal cord recovery program east of the Mississippi.
Wow.
And they've even got like housing so you can come visit your family member in Atlanta while they're doing the rehab, and they've got all this stuff, and they've got the connections for when you go back into your community. Now, I will kudos ECU Health, same thing, just not the name brand recognition as Shepherd Center.
Yeah.
But if you work at a that link between a hospital and rehab and you don't know Shepherd Center,
Hmm.
that's a problem.
Yeah.
So I ended up calling Shepherd Center and leaving a message, but our back was against the wall.
Right.
Because here's what a lot of people don't realize: when it comes to a discharge, if you decline the placement they suggest, you can become completely liable for that hospital bill from that moment forward.
Oof.
Your hospital can stop payment. And I'm aware of that. But our back was against the wall with the timing. So we were forced to take the first subacute rehab bed that was available. And I'm not going to mention their name. And I'm not going to use the naughty word that we've sometimes used to refer to this facility. We're just going to call it that subacute rehab facility who shall not be named. And we were there.
Hmm.
And that is why, when part of my business model, I help families with what I call those high friction point transitions: home
Yeah.
to hospital, hospital to somewhere else to home. I am there to make sure you land at the best possible place.
Yeah.
And when I work with a family, I find out all about that patient and the goals and the family and their ability to visit, all these things that I want to know about. And then I develop a list of non negotiables.
Hmm.
And based on that list of non negotiables, then I look for the best, most appropriate placement. And it's not easy. I've
No.
just spent probably 30 hours or more finding a placement for a medically complex gentleman. Lovely gentleman, amazing family, but he's medically complex. It took me about 30 hours worth of research and phone calls to find the just right place. But that's my job. I only work for him, and
Hmm.
that's my job.
Yeah.
And I'm committed to my job and what I do because no one else is going to go through what we went through, which is kind of how we got started in this. On
Yeah.
a cold, my husband had been home, and on a cold December night, I was, tucking him back into bed, and he said, I just wish you could take everything you know from your social work degree, everything we've learned,
Yeah.
and I wish we could use it to help other people. And I said, yeah, but we're both busy. But we
Hmm.
work full-time jobs. When would that happen?
Right.
And then 2 days later, I took him to his first appointment out in Greenville, and I realized this is going to take me out of work basically 2.5 to 3 days a week. So
Yeah.
I'm trying to figure out how I'm going to ask my boss, who had already been so amazingly gracious, so
Yep.
gracious with flexibility, more than you could ever ask. And I was trying to figure out, how am I going to ask her for all this time that I'm about to need?
Right.
And before I could even ask her that, on Monday morning, I got laid off in a Zoom call.
Mm.
It happens. And I walked out of my office and I said, honey, I know what I'm going to do with the rest of my life. I felt like that cartoon Phineas and Ferb. I know what I'm going to do with the rest of my life. And I haven't stopped since then.
Yeah.
And I am so blessed with all of the things we've gone through
Hmm.
to be able to work from home
Hmm.
while I provide care for my husband
Yeah.
and while I get to help other people.
Mhm.
And I wake up every day excited about, like, okay, what problem do I get to solve today? What challenge do I get to help someone walk through?
Right.
And you were so gracious. You rescheduled with me because something happened with his caregiving here. And then today he was getting therapy from the neurophysical therapist here who comes to our home.
Hmm.
And I had to go get ready for this. And so, and so, it's all these little moving pieces. And so
Yes.
every evening we're like, okay, what does tomorrow look like? Here's my calendar. What's your calendar? When are we going to fit all this stuff in? But
Right.
we've figured out how it works.
Yeah. Yeah.
And,
And that's what you do. You have to become flexible. I have to
yeah.
tell you, I have a sick kid home today,
Oh,
unexpectedly.
I'm sorry.
So she's downstairs quietly watching something on TV. But, I mean, things happen, right? Even,
It's just life.
caring in the way that you expect to care as a parent.
Right.
Your schedule can get blown up at any moment.
In a heartbeat, it can. Yes, absolutely. So that's kind of like where we are now.
Yeah. Well, oh, thank you for sharing all of that. I'm
Thank
sorry it
you.
was such a hard road, but at the same time, the things that you've learned and the things that you knew that helped you know what to do and
Hmm.
reinforced what you knew and how to navigate that, and then taking all of that to help other people
Oh yeah.
takes a different kind of person. And
Thank
so
you.
thank you for doing that.
Well, we're going to give that credit to God, because if it was up to me, it would have just blown up by now. So we'll say all the good stuff is from God, and I'm repenting from the bad stuff. Let's go with that. But thank you so much. Thank
We'll
you.
call it even.
Yeah, that's right. That's right. Absolutely. Yeah.
So your service is called the Healthcare Survival Kit.
Yes.
Is how do you want to describe it to people who are listening?
Here's how when people say, what do you do? Here's
Mhm.
how I respond. I'm so glad you asked this question. I say, you know how sometimes families, they have everything's fine, and then they have a medical crisis, and then they seem stuck, and they can't seem to get out, and they don't know how to find the exit, and they're like,
Yeah.
yeah. I say, I fix that. That is exactly what I fix. And they
Yeah.
go, oh, yeah.
Nice.
Yeah. And then it kind of sinks in, and then they kind of ask questions. And
Hmm.
I share very vague, de-identified examples of,
Right.
some of the things I've done. And they go, wow. And they're like, you're good to know. I'm going to keep your name,
Hmm.
available. So what I do, those high friction transitions.
Hmm.
I also do financial advocacy because I have medical billing in my background as well. And I've been fortunate enough to have a subcontractor who has what I call the PhD in medical billing, medical coding. And she picks up on those cases with me, and we can do that as well. But I love both of those groups of patients.
Yeah.
I love solving those problems for them.
Yeah.
So we thoroughly enjoy it. Part of what I enjoy is that I offer everyone a free 30-minute consult. I
Mm.
know that's kind of a controversy in the industry. Some do, some don't. I do.
Hmm.
And then my husband says I'm going to run myself out of business. He says I need you to stop solving all their problems in 30 minutes. Someone has to pay you, Cap. And I'm like, I know it, and I do have paying clients, but
Yeah.
people feel so alone and so isolated and so
Yes.
overwhelmed. And I understand all of those feelings. I've lived in that boat. It's
Yep.
awful. But literally, sometimes I just say to them, you're doing great. You're doing all the right things. I
Hmm.
have these three things for you. And anytime I have a free consult, I always try to leave them with between two to four things that they
Hmm.
can do independently before they
Yeah.
ever have to connect and pay an advocate, whether it's me or someone else. I
Hmm.
always want them to have that. And sometimes that's really all they need
Yeah.
are just those few, like, okay, say it this way next time you call the insurance company, or ask for this, or here's the resource for that, or here's the type of thing you're looking for. And then they're like, oh, this is great. I had a family reach out recently and I spoke to the husband and wife, and has a brand new spinal cord injury. And we connected. They're at the local hospital here in North Carolina.
Hmm.
And I asked, what have they recommended? And she said, there's this place in Atlanta. And I said, the Shepherd Center. And she said, yeah, have you heard of it? I said, I have heard of it. I said, but she had only been told about that one place. I said,
Yeah.
but there's ECU Health out in
Hmm.
Greenville. They have their own neuro team. Spinal Cord has their own gym. They've got a neuro lab. They've got neuro everything that you could want. And
Hmm.
I said, so you could end up at either of those and you will do so well, you may never need me again. And if you
Yeah.
never need to reach out to me again, we're going to part as friends and I'm going to be cheering for you because
Right.
I want the best for you.
Yeah.
But if you need me, I'm here. But when I sent the follow-up email, I thought, I added a few things in, like they've got kids. So
Hmm.
I explained to them that the data is out there that if you gamify someone's rehab, they make more gains and they can make them a little more rapidly, and they don't even realize they're making the gains because they're having fun. So I said,
Yeah.
here's how you're going to get the kids involved. And I gave them
Hmm.
some quick things to do with the kids when they come to visit mom so they can help mom rehab while they're, throwing a Nerf ball into a basket, kind of thing.
Yeah.
So, just leaving everybody better than how I found them is kind of that underlying theory.
Yeah. So, for folks who are interested in your service, how can they find you?
Oh, thank you for asking. If they go to healthcaresurvivalkit.com,
Hmm.
there is a button at the top. There's actually the same button several times throughout the page, and it's about getting a free consult.
Okay.
Just click on that free consult button, and you're going to see my calendar open up, and you're going to select the date and time that works for you.
Mhm.
I allot 30 minutes. Oftentimes they run longer, but I allot 30 minutes. It's okay. And I don't start charging at minute 31. Let me just put that out there. That's
Yeah.
not a thing.
You're
And
not a lawyer.
yeah, no, 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 no. And then I meet with them and people say, well, how do you start? And I just say, tell me what's going on and how I can help you today.
Yeah.
And then I stop talking.
Hmm.
I learned from a boss early on, if you're talking about yourself in the first 15 minutes you meet someone, it's not going well. And I thought, yeah, he's right. He is right. And so I just stop talking and I just listen.
Hmm.
Sometimes I have to direct, kind
Yep.
of how you're directing me through this. I kind of have to guide a little bit,
Right.
but I know what I need to know mostly in the first 20 minutes from all
Hmm.
that social work experience.
Yeah.
So then I can spend the next 10 minutes or so giving them some good direction and that
Hmm.
path forward. Really, what holds people back is not knowing. They don't understand the landscape. They can't see the landscape. They don't know what the
Yeah.
options are. No one's told them what the options are. People
Hmm.
people want to do what's right and they want to do the best thing for their family member. They just
Yeah.
don't even know what that is.
Right.
And so, but if they go to my website and click that free consult button, they'll get to meet directly with me.
Fantastic. Thanks for joining us today. We will be sure to include Kim's website in our show notes. And for all other resources, you can reach us at carefulist.com. Until next time, take care.